How to cure a dry cough from the throat. This is the third video in the How to Cure a Cough series. In the first video, I shared with you the main secret that a cough is a symptom. And if you help your doctors determine what disease the cough is a symptom of and treat that disease, then of course the cough will pass. In the second video, I told you how you can alleviate any cough depending on the level of its occurrence. At the nose, nasopharynx, throat, and lower respiratory tract levels. Links to these videos will be down in the description under this video. Today we will talk with you about how to cure a dry cough from the throat. This is one of the most unpleasant types of cough because this constant cough and tickling can significantly spoil the life of any person because it starts to interfere with him. And sometimes such a cough can be with strong attacks up to vomiting. I often get comments saying, enough of the blah blah blah, get to the point faster, give us a specific remedy. And I will provide you with these remedies and recommendations, but I will do it at the very end. So, if you urgently need a magic remedy, you probably need to go to some other channel. And if the cough really bothers you, if nothing helps, then follow the recommendations that I will give you before listing the medications and other remedies that will treat the dry cough from the throat. I remind you that cough is a symptom of some disease. And if you understand or help your doctor understand what disease your cough is a symptom of and cure this disease, then naturally the cough will pass and will not return to you. Of course, you may immediately use the remedies we will talk about later. The cough will pass and will not return as well. But if this goes on for a long time, then most likely the medications you will be using can cure the cough for a while. But if there is some constant problem that triggers this cough, then naturally it can return. I always fight for the patient's health and strive to solve the problem, not to alleviate it temporarily. A dry cough from the throat is associated with irritation of the mucous membrane as a result of an inflammatory process. Why can the throat become inflamed? Well, first of all, because of the foci of inflammation, which are most often found in the tonsils, in the glands. In addition to this, besides the fact that a dry cough is disturbing, the throat as a rule often hurts. The lymphoid granules of the back wall of the throat can be inflamed. All this affects the overall mucous membrane. The cilia that transport mucus start to work slower. The mucus becomes thicker, more viscous, and triggers coughing and dry cough. Therefore, the first thing you need to do is to go to an otolaryngologist, show him your throat so that the doctor can assess the condition of the throat and rule out signs of inflammation from the glands and from the lymphoid tissue of the throat. That is, whether the lymphoid granules are not enlarged, whether the lateral ridges of the throat are not inflamed. Inflammatory processes of the lymphoid tissue are usually associated either with a bacterial process or with a viral one. Therefore, it is classically recommended to take a complete blood count, anti-streptolysin O, which is elevated in the presence of a pathogenic and streptococcus. And a swab from the throat for PCR. This is a type of diagnostics for Epstein-Barr viruses, cytomegalovirus, and herpes virus type 6, which are very often active in throat problems. If they are active, they are detected in a swab from the throat for PCR and accordingly require treatment. If the ear, nose, and throat doctor will think that the process is bacterial, he will give you certain recommendations. If the process is viral and the ear, nose, and throat doctor does not have knowledge about the complex treatment of these viral infections, you can additionally consult an immunologist. Soon we will move directly to treatment, but for now let's talk about the causes. Often there is an allergic inflammation of the throat mucosa due to allergies to food products or inhaled air. Therefore, if an ear, nose, and throat doctor tells you that everything is fine with your throat, If a cough is observed under certain circumstances after consuming certain products, then in addition to everything else, you need to be examined by an allergist. The nose, nasal passages, and nasopharynx can also cause a dry cough. If there are certain inflammatory processes in the nose, this can certainly begin to affect the mucous membrane of our throat and can trigger, among other things, a dry cough. That's why when you go to an ear, nose, and throat doctor, the ear, nose, and throat doctor should also look at, of course, the nose, ideally to rule out problems with the nasal passages and the nasopharynx, especially in children. The stomach can cause a dry cough when there is reflux from the stomach into the esophagus. From these refluxes, the mucous membrane gets irritated and causes a tickle and dry cough in the throat. Therefore, if you have symptoms, problems with the stomach, nausea, belching, burning in the mouth, a sour taste in the mouth, you must go to a gastroenterologist and rule out reflux disease. And if it's a child, then the child is given an ultrasound of the stomach with a water siphon probe to diagnose reflux. In adults, as a rule, a gastroscopy is performed, but this examination is now done with very small endoscopes and is quite comfortable to undergo. In adults, dry cough is often encountered, especially in hypertensive patients, when taking certain medications with prolonged use. Therefore, if you suffer from any chronic diseases, especially cardiovascular system, then look at the drugs you are taking. Can they cause a dry cough? Often we identify these drugs, test them, temporarily cancel them, or replace them with cardiologists on others, and the cough passes. The cough reflex can also simply get stuck at the throat level, and so-called psychogenic cough arises. But this does not mean that something is wrong with the patient's psyche. The reflex can simply get stuck. This is especially often observed in children and adolescents. And if a dry cough does not alleviate anything, then we watch such children and adolescents. We observe them when they are strongly interested in something. For example, if they are playing an interesting computer game, their cough begins to pass, which means there is a high probability that it is actually psychogenic, especially if you have already ruled out all other causes. In fact, there are 56 causes of chronic cough. Today, I told you about the most common causes that cause a dry cough at the throat level. If you've gone through this first round and the problem persists, then of course you need to dig deeper and move forward. If you need my help and you are in Moscow, you can make an appointment to see me at the clinic. All information is on the website rabrov.rf. Links are in the description and will appear here now. If you live somewhere in the region, then online consultations may be possible. Information is also on the rabrov.rf website. Well, let me tell you about the treatment methods. Yes, that is about those, let's say, medicinal preparations, folk remedies, which you can use to treat dry cough from the throat. First of all, we need to remove the inflammatory process, remove irritation, and soften the mucous membrane. If the throat often hurts, then there is a very high probability that there are more viruses and bacteria than necessary inside the lymphoid tissue and on the surface of the mucous membrane. Therefore, we definitely prescribe local antiseptics to such patients. The most popular ones are myramistin, chlorhexidine, furacilin. We prescribe rinsing about 3 times a day on average. If the throat hurts rarely, there's just a tickle and cough, then local anesthetics are not necessarily applied. Especially if you have been to an ear, nose, and throat doctor and he told you that overall your throat is quite good and there are no signs of chronic inflammation in it. With any signs of dry cough in the throat, we prescribe soothing treatment. If there are no contraindications, no allergies, then phytopreparations help best of all. The most important thing you need to understand is that you should get relief from treatment. If on the contrary, the cough intensifies, the choking increases, then this means this medication is not suitable for you. Something else needs to be applied. For example, we often use chamomile. It has antiseptic properties. Some people find it very soothing and moisturizing for the throat, while others find it drying. That's why we brew chamomile, start drinking it, sipping it. It soothes, you feel improvement. Continue doing this 3 times a day. If, for example, there is some kind of dryness effect, then naturally this is not suitable and we try the next remedy. For dry cough, we often prescribe honey. You can brew it like tea and just drink it. We really like to take it. We really like to prescribe marshmallow, which can also be brewed or used in lozenges for sucking. If the cough is really persistent and you feel like your throat is spasming, you can try colt's foot. It contains many essential oils and has such a relaxing effect. We also often use mint and eucalyptus, which you can simply add to tea or brew separately. There's another very good one. We call it Grandma's Remedy. It's boiled milk. For example, you boiled a glass of milk, added a tablespoon of butter, a teaspoon of honey, mixed all this, and when the milk has cooled down, becomes warm, you drink it in small sips. It's good to do this at night before sleep. It soothes very well, coats the mucous membrane. You can familiarize yourself with the detailed recipes of the preparations I just told you about in a special video. A link will appear here now. There will also be a link in the description under this video. We will not dwell on this in detail now. If you have contraindications to the use of herbal decoctions, you have an allergy to flowering, then we often prescribe the OKI drug. There is such, ketoprofen. This is a local anti-inflammatory drug. It is sold in the form for application. We can rinse the throat with it 3 times a day, thereby removing irritation, removing the inflammatory process. We usually prescribe it for 5 to 7 days. Make sure to read the instructions carefully as there are contraindications. If you have a compressor inhaler, be sure to do inhalations because the more moist the mucous membrane of the throat, the less the cough reflex. For inhalation, we use either saline or a salty mineral water like a Centuki 17 or a Centuki 4, Borjomi and so on, which contains a lot of salts. The concentration of these salts is insignificant. It does not dry out the mucous membrane in any way, but rather softens it. I often get asked this question, but again, it's all individual. If you started doing the inhalations and feel that something is growing, it means they are not suitable for you, cancel them. What else is important? It's important to note that a dry cough from the throat often occurs, for example, during the winter period, when the humidity in the rooms is low and the mucous membrane simply dries out. Therefore, make sure that in your homes, if you have a dry cough from the throat, the temperature should not be more than 24 degrees Celsius and the humidity should not be less. Accordingly, we lower the temperature by covering the batteries. We increase the humidity with the help of a humidifier. Any ultrasonic humidifier is ideal for this. This is the basis for treating a dry cough from the throat. And if this doesn't help you, it means there is some serious reason and some constant illness during which this cough persists. So we watched the first video. Yes, that is the main secret of treating any cough is determining the cause. If you understood and your treating doctor understood what the cough is associated with and cured this disease, then everything necessarily passes. Get treated and be healthy. Your Dr. Krabrov.